Welcome back to Hey Baby and Beyond. I'm Lauren, an antenatal and postnatal teacher here in the UK. Today I want to talk about one of the most commonly asked questions that I get in antenatal classes of parents-to-be, and that is, how do you know that you're in labour? What are the signs of labour commonly? Most people do think that the waters breaking will be the first sign of labour beginning, and actually it's really common for waters not to break until around 8 centimetres. Some people's waters don't even break. So we're not looking always for waters to be breaking as a sign of labour starting. Some people's waters do break, and obviously if contractions don't begin, we need to consider the next steps. But more commonly than not, waters do break during the labour process, or some people might be offered to have their waters broken during labour, and babies can be born, like I said before, in the sac of waters. So what are the signs of labour and what do people commonly experience? Well, they do really vary from person to person. For some people, it might be on and off back cramps, it might be hip ache, it might be tummy ache, it might be contractions or surges that are coming consistently. But what we're looking for is around 3 surges or contractions in a 10-minute period to be considering labour might be starting. Some people might feel sick, some people might have sickness and diarrhoea, some people might have absolutely nothing and just wake up and start to have the contractions or the surges. There is absolutely not one set rule for signs of labour, and most people do get a few signs collectively that might show that they're in labour. As we know that latent labour, that very, very first part, which is completely closed cervix to being around 3 centimetres, can take anything from a few hours to a few days to a few weeks. So you might find that you're experiencing some of these things on and off for quite a few days or weeks before labour actually begins, and that's why it can be super frustrating. One of the best things that you can do is rest and relax and make sure that you're saving your energy up for when the actual event happens. Keeping in your upright positions when you're not resting and relaxing, keeping active, keeping mobile, keeping hydrated, and making sure that you are looking after yourself in the last few possibly hours, weeks or days before your labour begins, because we need the energy when you do go into labour. You can always ring maternity triage, get some advice off them, see whether they want to see you or just see whether they want to log what you're feeling and experiencing. But remember, if you ever want to go into maternity triage and be checked over, then they will offer you that option. But just remember that if you're not in established labour when you get there, you probably will be sent home for a little bit longer to see if things progress. I hope that helps clear things up a little bit. Do comment below what your signs of labour were or what you've heard they might be. But thanks for watching this video, and I hope that you're feeling a little bit clearer on that. Don't forget to follow, subscribe and like this video.